Hello, gentlemen. Hello, ladies. Welcome back to psychology class. Our topic for today is mood disorders, and we're going to be taking a look at two of them. First, we'll look at major depression, and after that, we'll take a look at bipolar disorder. The first thing we want to do is note that you and I, as normal folks, or let's pretend that that's the case, we have our moods, ups and downs also. Our daily life ups and downs, as you see here in this particular chart. Sometimes things don't go so well at all. You flunk a test, and then for a day or maybe two, you're a bit on the low side, and then you meet somebody nice and sweet, and you fall in love, and you get high, and you run down the beach trailing flowers behind you, and then after a while, you come back to normal. Well, those blues that you may have after you do badly on a test, that's depression, but it's not the same thing as major depression. In the case of major depression, you're looking at a very, very low mood that lasts a long time. In fact, a minimum of 2 weeks is required, and on average, if left untreated, major depression will last for 6 months. That's a lot longer than how badly you may feel if you do poorly on a test. With major depression, the individual may have problems even functioning. It tends to occur more often in women, tends to run in families. There may be psychotic features, certainly not all the time. This is a situation where a person loses contact with reality somewhat. And, of course, with major depression, there is the risk of suicide. So let's take a look at our figure now. And you can see that with major depression, the low may run considerably lower, and that it runs 6 months on average if left untreated. 2 weeks minimum is required. Fortunately, there is treatment for major depression. Hurrah for that. What I'd like you to do right now is watch about a 3.5-minute video from the National Institute of Mental Health. Click the button above my finger, please. If you missed the link to that video on depression, hit the stop button, back up now, go back and watch it. It's very well done. A few moments ago, you heard me say that there is the chance of suicide when a person becomes depressed. Does not always happen, but let's take a look at what some of the risk factors are regarding depression and suicide. Yeah, suicide is a tragedy, and it does happen. But who's more likely to commit suicide? Well, men are more likely to kill themselves than are women, especially a single man who is older and who is in poor health. It may be seen as a way out of life. People who have access to guns are more likely to kill themselves, and in fact, the use of a gun when committing suicide is more often lethal for some pretty obvious reasons than are medications, because at least the first time or two, the person may take a medication dose that's not large enough to actually succeed. People who've made prior attempts at suicide, if they make a follow-up attempt, are more likely to succeed. Family history of suicide, being around people who have committed suicides, friends, those things increase the likelihood of a suicide success. People who have been abused have an increased risk of committing suicide later. People in jail or prison, people who in general have bad judgment and engage in risky behavior are more likely to commit suicide. In terms of suicide attempts, which is sometimes described as parricide or parasuicide, about 2% of all adolescents have at some point in time made a suicide attempt. All suicide attempts should be followed up by some sort of medical or psychological treatment, because if this is not done, there's an increased chance of future attempts with a greater degree of success. Let's take a look at another mood disorder now. Let's look at bipolar disorder. And an advance heads up, there are two types of bipolar disorder, type 1 and type 2. With bipolar disorder, what we are looking at is alternating low depressed moods and contrasting high energy moods, sometimes called manic episodes, or in some other cases hypomanic episodes. Details on that to follow. Now, the depressed moods look exactly the same as major depression, What makes it different is the up or the high, a manic episode. And during this time period, the person has a great deal of energy, enthusiasm, self-confidence. They may become very angry if they get crossed, and they may engage in very reckless behavior. Let's stop for a moment and hear from a lady who has some history of bipolar disorder. So if you'll just click on the button above my head there, movie's about 2 minutes long. I think you'll find it worthwhile. If you missed the link to that video about bipolar disorder, hit the stop button now, back up, and watch that video. It's worthwhile. Welcome back. What I'd like to do right now is show you a figure that you saw before with an addition. And what you see is that the low of our bipolar disorder here in blue is as low as for folks with major depression. But look at the incredible high that the person is experiencing, much higher than when you fell in love or perhaps got a crush on somebody. And then they go back down into the lows again. Sometimes people will have short periods of normalcy between mood swings, but that does not always happen. Now, if you think back to the video that you saw a few moments ago where the lady talked about type 1 and type 2 bipolar disorder, look at the addition, how this figure has changed. Type 1 shows the extreme high. That's where the person goes to the hospital very quickly, very early in life, because they become so completely out of it. The type of bipolar disorder that's far more difficult to diagnose is the type 2. And look at the high. It's not so high. It's about as high as somebody who is in love, and they can continue to function in life, and in fact may have some considerable success during these time periods. This type of a high is called a hypomanic episode. Hypo means low in front of manic, as opposed to a full-blown manic episode in type 1. Why would this second type of bipolar disorder want to be diagnosed? Well, look at the major depression that they're having. And the usual medications for treating major depression don't work with bipolar disorder. It's a different disorder, even though it's got the same depression down there on the bottom end. So here's hoping that you found this presentation on mood disorders useful, informative, educational. Have yourself a great psychology day.